Hi, my name is Dr. Jamie Scully, and I'm a naturopathic doctor practicing in Washington State. So I see quite a few people with hypothyroidism or low thyroid function. And so today I wanted to talk about a test called Reverse T3. And this is a test that I think mostly is ordered by those of us in the naturopathic community versus the conventional community. But I think it can be really useful in helping to treat hypothyroidism. And so I wanted to talk about it today and let you know what it is, how to know if it's elevated, and some reasons why reverse T3 might be elevated in the first place. So the usual labs that are ordered in order to diagnose hypothyroidism or monitor it are TSH, T3, and T4. And so these are pretty commonly ordered in diagnosis and in monitoring the progression, especially if you're on medication. Your doctor wants to make sure that the medication is at the right dose and you're not still low or too high. And so both of these hormones, the T3 and T4, are both thyroid hormones. The T3 is the active hormone that has activity at receptors around our body. But both of these can be converted into reverse T3. And so the body may do this because it acts like a safeguard against too much stimulation by thyroid hormones. Because if you have too much stimulation, that can really lead to some very concerning symptoms too. So in that case, you may feel anxiety, sweating, insomnia, palpitations, heart palpitations, chest pain. So that can be very concerning as well. And so if the body converts these hormones to the reverse T3, that just helps to prevent that from happening. So there are many different symptoms that can be involved in hypothyroidism. And because the thyroid really helps to control a lot of our other body systems, so symptoms can really be body-wide. And some common symptoms can include fatigue, weight gain or difficulty losing weight, mood changes like depression, brain fog, or difficulty remembering things or concentrating, feeling cold all the time, like you just can't get warm no matter what season it is or no matter what you're wearing, menstrual irregularities. Hair loss is actually a really common one too. And you can have nail changes, dry skin. So there's a lot of different symptoms that may be involved in hypothyroidism. So there are a couple ways to know if reverse T3 is elevated. And so this requires a blood test. You can look at reverse T3 itself, and you can look at the ratio of T3 to reverse T3. And so it can really depend on what lab you use. LabCorp is one I use. It's a pretty common one, at least here in the United States. And their range goes up to 24 nanograms per deciliter. And but so that's kind of their top of their reverse T3 range. But in kind of talking with and working with other colleagues and other ND colleagues, many of them will consider a cutoff about 15 and above that to be elevated. So that's one way to kind of take a look at it and see if it could be elevated. So the other way is to look at the ratio of free T3 to reverse T3. And if this ratio is below 0.2, meaning that there's a lot of reverse T3 compared to T3, then that may be considered to be elevated, because in that case, it looks like T3 or T4 even may be being converted to reverse T3. And so looking at both of those can be a good way to gauge if reverse T3 is high. I always also look at other labs, other thyroid labs, and take into consideration the patient's symptoms as well. So there are a few reasons why reverse T3 might be elevated. So in general, you will have elevated reverse T3 if you are sick, if you're stressed, or if your body's undernourished. Because in these circumstances, the enzymes that convert thyroid hormones to reverse T3 are elevated. So one big reason that you definitely want to know about is if blood sugar is imbalanced, if it's if insulin resistance is developing, or diabetes is present. Because in this situation, having a lot of sugar in the bloodstream just consistently is very inflammatory and can put a lot of stress on your immune system, on your cardiovascular system. And so in this case, you definitely want to know about that so you can do something about it. So another reason would be chronic viral infections. And so this can include many different viruses, but especially Epstein-Barr virus, or EBV. And this is why I always want to know, I always want to test for EBV in patients that have hypothyroidism, or especially if they have Hashimoto's hypothyroidism, which is an autoimmune disease. And so these viral infections, or even gut infections, so digestive infections, are really important to find out if you have those, because then you want to treat those, because all of this just chronic infection that's going on puts a lot of stress on the body, on the immune system. It can cause body-wide inflammation. So those are two really important things to know about if your reverse T3 is high. So another reason why reverse T3 might be elevated would be if you are under chronic stress. And so in this type of situation where you're in fight or flight mode, your body's going to release cortisol, and so this hormone depresses the thyroid and depresses the thyroid function, and it can push the thyroid hormones into reverse T3. And kind of along the same vein, if you are dieting or if you're just not taking in a lot of calories, this stresses the body out as well and can result in that increase in cortisol too. So in these two types of situations, it's really important to make sure that you're getting enough calories, that you're getting enough food, eating frequently. Also, it's important to know what the adrenals are doing and what the levels of cortisol and other adrenal hormones are. So this is also why I do some of this testing as well. And just identifying different stressors that you might have and working on ways to help to manage that stress in a really healthy way definitely comes into play if this is part of your life and part of your lifestyle. And so the last reason why reverse T3 might be elevated would be if there are liver or kidney issues going on. And this can be determined pretty easily with blood tests or urine tests, depending on what's going on. And it's very important to know if there are issues going on with the liver or the kidneys, because they are definitely vital organs for us, for our survival. But they're involved in this hormone conversion because these organs are where some of that hormone conversion takes place. So in all of the reasons that I mentioned, it's very important to identify if there are issues going on in these areas and work on resolving them if you can, in order to help to balance thyroid hormones and bring down that reverse T3. I hope this video helped you to understand a little bit more about hypothyroidism and thyroid testing. If it did, please like, share, and leave a comment. Or if you have questions about hypothyroidism or anything else, please feel free to reach out. I am at www.jamiescullynd.com, and I also write a weekly blog, so if you're interested in learning a little bit more about hypothyroidism or thyroid support, definitely check that out. Or you can find me on social media. I'm on Facebook and Instagram at Dr. Jamie Scully. So thanks again for watching. Have a good day. Bye-bye.